On our last episode, we shared some important insights from the National Safety Council on navigating federal and state regulations when developing a first aid policy that addresses anaphylaxis. But what about the employer perspective? Hello, I'm Barry Eisenberg, Executive Director of the American College of Occupational and Environmental Medicine, and welcome to the third installment of our ongoing series on anaphylaxis in the workplace. Creating a safe working environment requires an emphasis on company-wide anaphylaxis awareness, policies to avoid accidental exposures, and a compliant, comprehensive emergency response plan. In this episode, we'll acquire some unique insights from a guest that has a vast amount of experience with emergency response plans in multiple business sectors. But before we begin, if you are just joining us for the first time, you can view all the previous programs on demand at ACOEM.org. And feel free to email us any questions you have along the way, and we will get back to you with answers from our guests or from the ACOEM team. Our guest today previously served as Director for Integrated Health and Corporate Medical Director for Cisco, and is currently Walt Disney Parks Chief Medical Officer. If anyone knows how serious anaphylaxis is in the workplace, it's Dr. Pam Hymel. Pam, welcome to our program, and it's nice to see you back here at ACOEM. Thank you for joining us.
Happy to be here, Barry.
Let's start out talking about your experience in the workplace. How important is anaphylaxis, and what role does OSHA play?
Well, all workplaces, regardless of size, have the responsibility to have a safe and healthful work environment under the Occupational Safety and Health Act of 1970. And employers are liable to enforcement action if they don't maintain that. Quite frankly, having a safe and healthful work environment is important for creativity, innovation, productivity among workers. And it's been shown that having a safe work environment is a great stepping stone to a healthy and focused workplace that's focused more on wellness. So we want to make sure that employers understand a safe work environment really does help the bottom line. As a matter of fact, in 2006, workers' compensation costs alone cost employers $88 billion. So just being able to mitigate those costs is a business case for wanting a safe environment. And that doesn't even begin to hit some of the other healthcare costs that employers are incurring these days. So OSHA really does encourage a joint partnership between employers and their employees on creating this safe and healthful work environment. So I know we're here today to talk about anaphylaxis in that work environment. And when we think about what is anaphylaxis, it really is a severe allergic reaction to a chemical that's become an allergen, and it happens very quickly after exposure, and it's severe. So it's important for employers to really make sure that their employees are aware of reactions that can occur among their coworkers. Anaphylaxis and anaphylactic reactions have been increasing over the past several years, and it's very important for employers to have some type of workplace education programs so that they can encourage employees to know how to react if they see a severe allergic reaction going on in their workplace. So one of the things that we've learned about anaphylaxis over the years, a census by the U.S. was done in 1999 that shows that up to 40 million individuals in the country are at risk for anaphylaxis, and up to 13 million people could have anaphylaxis due to insect stings. We also know food allergies are increasing. We have about 8% of children under the age of 18 that have food allergies. Around 4% of adults have food allergies. And we know that there were 200 deaths attributed to food allergies alone on an annual basis. Another thing is we work in healthcare. A lot of our members are in healthcare, and there are 18 to 17% of healthcare workers that are latex sensitive. So it's becoming an issue even in healthcare settings. We also know that asthmatics are more sensitive to severe anaphylactic reactions. So again, just being aware of all these facts help us be more vigilant when we look at our workforces.
Pam, with some of those statistics you cited, certainly avoidance is a major issue. Again, from your experience, what are some of the best steps or best practices that companies might employ to avoid and or manage anaphylaxis?
Well, information is key, and information on the signs and symptoms and causes are an important part of health and safety training at the workplace. And trainings can occur both in person and online. So however your company decides that they're going to conduct health and safety training, it's important to understand the signs and symptoms in order to have quick assistance to people who are suffering anaphylaxis. So while it's encouraged that coworkers or workers identify themselves and let their supervisors or coworkers know if they have severe allergens, that's one of the things that we can't mandate because of confidentiality. So making sure that there's a general awareness is an important part of a workplace health and safety program. Other things that employers can do is make sure that employees have basic guidelines to operate within, such as if you have allergies and you're using shared equipment, that you have sanitizing wipes to wipe down the equipment between uses. Certainly making sure that food's labeled at meetings so that people know what ingredients are, and in cafeterias is an important element for avoidance. And then being able to make sure that coworkers that have to share desks don't eat at desks, or alternatively wipe them down in between uses.
Pam, you mentioned the importance of confidentiality in the workplace. With that, are there still some steps that employers can take to identify at-risk personnel?
Well, I think if you have an in-house medical department, encouraging employees to go to that department and talk to the doctors and nurses and make them aware is an important first element. And certainly they can have, the physicians or nurses can have a discussion with the employee about making sure that potentially their coworkers or supervisors understand that they have these allergies and could be subject to an anaphylactic reaction. We know that we have to be cognizant of confidentiality issues, and if an employee does not want to disclose, they don't have to, but educating them on the reasons they should, I think, is an important element. It can also help provide medical treatment quicker if people know that someone might be subject to an anaphylactic reaction.
Pam, we've also talked a lot about company-wide awareness. What kinds of general workforce education programs have you seen as being most effective?
Well, general awareness is key, and certainly incorporating anaphylaxis and what to do in case of that into health and safety training is an important element. Also, incorporating it into some of the health and wellness messaging that goes on in the workplace is important. In flyers, in brochures, in mailers to the home, on the internet. I know at work we have a weekly safety tip of the week, and being able to talk about anaphylaxis in the workplace could be an important and great topic for something like that. And then also making people aware of situations not only at work, but what they might encounter when they travel, or if you have children, what they should be aware of as a parent on what can happen at school is also an important part of education. Also, I think one of the things that we need to make sure that people know is an important element in taking care of their own personal health is to make sure that if they do have severe allergies, that they have an epinephrine auto-injector with them and that they know how to use it, because that will be an important element. One of the resources that's available out there is something known as FARE, F-A-R-E, which is the Food Allergy Research and Education Association, and what they have are important resources that are readily available to download so that you as an employee or an employer or even as a parent can download information that talk about emergency plans. So for your workplace environment, or for instance, if your child has peanut allergies, they have information for parents to provide to the school with posters on how to help avoid exposures in that work environment or that school environment.
Pam, in terms of readying employees in the event of an actual incident, are there some particular training programs that you would recommend?
Well, at a minimum, employers need to follow OSHA guidelines for training. And certainly the American Red Cross and the National Safety Council have training programs on safety that incorporate how to respond to an anaphylaxis reaction. Also, due to the increase in number of people with severe allergies these days, the National Safety Council has developed a whole separate module on responding to anaphylactic reactions, much like a CPR or AED module is structured. So employers need to make sure that their first responders have updates and training on a periodic basis. Also, it's important to post information on educational topics in things like break rooms or in staff lounges. Also, being able to raise the awareness on the signs and symptoms of anaphylaxis through some of the educational content that employers provide is an important element in helping avoid severe reactions. So I know employers are always looking for lunch and learn topics, food allergies or allergies in general, and how to respond to an anaphylactic reaction would be a great topic for a lunch and learn.
Thank you, Pam. Shifting gears just a bit, and again, drawing from your experience as a corporate medical director, what are your thoughts about organizations that deal with large volumes of patrons? Here I'm thinking about theme parks, museums, stadiums, and so on.
Well, it is important to make sure that you train your employees on how to react if a visitor to your organization has a severe allergic reaction. So that's an important element in training. And then it's also important, again, that each of us take responsibility for understanding our allergies and making sure that we educate ourselves and our children about food allergies or allergies in general. People with allergies can lead a normal life. They just need to be aware of their surroundings and take a few precautions when going out into public places. First, always make sure you do have an epinephrine auto-injector if you have severe allergies, and make sure that it's readily accessible, that it's not buried at the bottom of your purse or your briefcase so that you're having to dig for that, because time is of the essence. Also, carry hand sanitizing wipes so that you can wipe down tables or other objects that might have been touched by others that could expose you to an allergic reaction. And then review your surroundings. Make sure that if you're sitting down at a park that you're not sitting next to a child eating a peanut butter sandwich if you have food allergies to peanuts, for instance. Also, if you're out visiting and can bring your own food, then that's great, because you don't have to worry about having exposure in a restaurant. Or conversely, make sure that you talk to the wait staff or the chef about what your food allergies are so that they can accommodate those when preparing your food. So those are a couple of ways to work in those public settings.
Thanks again for joining us, Pam. We really appreciate your taking time out of your busy schedule to be here with us. I know that your ACOEM colleagues will really appreciate it as well, and hope you won't mind responding to a few questions.
Certainly.
Before we go, if you are just joining us for the first time, you can view this program again and all the previous episodes at acom.org/anaphylaxis. And feel free to email us any questions you have along the way, and we will get back to you with answers from Pam or from the ACOEM team. Be sure to join us next time when our guest is former Delta Airlines Medical Director, Dr. Thomas Faulkner, who will discuss how the airline industry approaches anaphylaxis. Until then, thanks for watching.